everybody, Dr. Anjana Bhana here, and we are currently at the end of the Sculptra launch, and I'm super stoked to have grabbed Dr. Nicole Kanaris. This is her third interview with me. As you know, Nicole is an exceptionally experienced aesthetic doctor, also based in Johannesburg, an OSHA trainer, part of the Elegant AMI, as well as just like a PRP trainer in your own right, independent training besides being part of AMI as well as the OSHA. So, Nicole, what did you think about the Sculptra launch? Is something you'd use in practice?
I absolutely love it.
Yeah.
And Jana, my philosophy in my practice is I don't want people or patients to walk out with noticeable work done.
Yes.
So with that philosophy, I think it just blends into what we're doing, giving them results based on stimulating their own collagen.
And that's the cool thing, because we both are big lovers of regenerative aesthetic medicine, PRP, PRF, and now Sculptra, which is it's just like creating almost like a wound using some stimulation, some inflammation, and your body healing itself. So I think people will like that. I think they like the idea of that, like you say, and people don't look too different. And now with the increase in male aesthetics as well, I'm seeing a lot of guys, I'm sure you see a lot of men at your practice, and they don't want to look done. They don't want to look
puffy.
Yeah.
That's the word we keep on getting, that puffy face. I don't want to look overfilled.
Yes.
I don't want people to notice I've had work done.
Yes.
And so with that in mind, this is something that's just going to stimulate your own skin,
yes,
your own body to tighten, lift, and volumize a little bit, which I love.
Yeah, I actually had a thought. I think I'm going to call it the Paul Rudd treatment. Nicole posted something on Paul Rudd. Paul Rudd, Ant-Man. So he is
never ages.
Never ages. And people want that look, that natural, like glowy, radiant look without looking fake. Sort of, what's it, Simon Cowell? That's because people use celebrities as references. So especially male aesthetics. So it's really nice to have that sort of reference.
And the thing is that they notice the bad work that's done.
Yes.
Incorrectly placed fillers. And now at least with this, there's no incorrect placement as such.
No.
You can't really duff it up because you placing it in a specific plane to stimulate your own collagen for tightening. And so it's not volumization. Obviously, if you're doing it incorrectly, you could get volumization. But it's not volumizing and feminizing a man.
Yeah, it's like lifting and rejuvenating.
Yes.
So I'm pretty excited. And also another thing, I know we both love it, and it's also a sort of a bioremodeler. They say that's a marketing term, but is Profilo or 3D, I don't know what to call it, because in South Africa, but this is for educational purposes. In South Africa, we can't really name medical device name brands, but we've been saying Sculptra the entire day, so I think it's fine.
We might as well say what you're going to say.
But that's also something that people are loving.
Very popular.
Yeah, it is. And also they don't look different, low downtime. And I think it would be nice to combine the two of them, actually.
Definitely, because I think the patients who've seen results with that, you can just tell them you're giving them even a stronger platform now.
Yes.
I had it done in my neck, and I love that pinch test because I've been pinching my neck like over the last week, and it feels different.
It feels that
you feel your skin texture is definitely thicker. The elasticity is better. The skin is healthier.
Yeah, you look like you've been on a good vacation, like on your face, as well, like the radiance and okay. So I do threads in my practice. Nicole is like, threads are too much admin. She's not a thread person. But what I've been telling patients about Sculptra is it's basically liquid threads. It's like polylactic acid. That's a liquid. But what I like about it is the no downtime. I like that there's no real discomfort, real pain. So I'm pretty stoked.
I'm quite sold on it.
Yeah.
And I'm hoping patients will be too.
But what's your favorite treatment, Nicole? What's currently?
Definitely fillers.
Okay.
My HA fillers. I love sculpting a face. There's nothing better than a patient walking in one way with one facial shape, and you've just elevated everything, and they walk out looking fresh. Like for me, there's nothing better than that.
Immediate. I think that's the whole. Unfortunately, Sculptra, as we've said before, does take a bit of time, and fillers are a nice complement to that because they give you that instant gratification and also a result.
And you still will need fillers.
Yeah.
Even if you are doing this, there's certain areas you can't treat.
Yes.
And there's certain modifications that you can't make with a specific product.
Yeah.
So We still need the HA fillers.
Okay, but thanks, Nicole. Thank you for joining me again today.
Thank you.
And I know this is not the end. We're going to go off camera, but we are going for drinks now and going to chat about other stuff, not just sculpture.
Hopefully not. Just
So thanks, guys, for joining us today. And if you have any questions, drop your comments in the little lines down below. Like, share, and subscribe. Bye.
Bye.